So one of the case that I could remember very clearly even till date, right, was during my first year of running the business, there was a patient that came to me with a symptom of frequent burping. So when I arranged for the client to see a specialist, after going through the scans and some blood work, he was actually diagnosed with stage 4 colon cancer.
So Shantal, what do you do as a healthcare navigator?
As a healthcare navigator, right, what we do is to match the patient to specialists based on their sign and symptom. But in today's context, because of the changes in the insurance policy, we will then also check out what insurers are they using so that we can match them to the right panel of specialists.
So what's the typical user journey of the patient? Like how do you come across these people?
So normally we do a lot of marketing and then we do a lot of tie-up with corporate companies as well as insurance agents.
Okay,
yeah.
okay.
So what they do is they will then tell us that the client has this symptom, this is their policy, and then we will pick up the case, do a simple triaging based on the policy that they have, whether is it enforced, is it lapsed, are there any exclusion. From there, then we will match it to a specialist that is under the panel and we book the appointment for them.
Okay.
Yeah. And if it's for foreigner, we will usually find out when is their flight schedule into Singapore so that we'll try to match it on the day that they arrive so they do not waste extra time to actually find a doctor and then, extend their stay.
Arrange the transportation for them as well?
Yes, we do. In some cases, if they require, sometimes even for evac cases, we do arrange a medevac for them as well.
From which regions?
More on the ASEAN side. Yeah,
ASEAN
so
side,
Indonesia, Vietnam, Thailand.
So they evac, then they go straight to the hospital?
Yes, that's right. They land in Singapore, and then from there we get an ambulance and send them to the airport, to the hospital.
Right.
Yeah.
What are some of, how do they land in Singapore? They come in a helicopter?
Usually it's a
private plane?
sometimes it's a private plane, sometimes it's a private hire medevac where there are ambulance equipment in there.
In the aircraft itself?
That's right.
Okay.
Oh, that's very interesting. Oh, actually,
you never knew, right?
Yeah, I never knew that.
Yeah, very expensive,
They are of that.
Do you know what's the cost of like a medevac?
So, example, if it's from Indonesia, Jakarta, the range can be from 29,000 USD all the way to 35,000 USD.
Only me, I thought it was 100 over.
No. 100 over is probably like further out. Or maybe they have to make a few stops before reaching Singapore.
Like taxi, still got few stops.
Yeah. Because if it's very far, then they need to do the fuel.
Okay.
Because it's a smaller plane, right?
Yes, that's right.
It's your own private jet. It's cheaper than a first class ticket. Come on.
Oh yeah. Okay, sure. Yeah, true.
Yeah.
And what's the most recent case that you had for medevac?
The most recent one, we had a case where the client is diagnosed with stroke. Yeah, so they
from Indonesia?
Yes, that's right, from Indonesia. And they needed a second opinion because in Indonesia, no one could diagnose what the condition was. In fact, they don't even know that it was a stroke.
Huh?
Oh my God.
Yeah, and none of the scans were done. Basically, doctors were taking on a more preventive care over there, giving medications just to control the symptom. Yeah, so the family called and then we arranged a medevac for them to come over to Singapore to seek treatment.
And how did they not know it's a stroke? Because it's mild lah.
Yeah, it was mild, but actually the condition was quite severe. The client was in a high dependency ward when he arrived.
Oh, wow, okay. And the doctors there didn't know?
No. Yeah.
Wow, that's a mind blown.
So why do they not know? Is it because they don't have they are not exposed to such cases enough, or competency level of that?
I wasn't too sure what exactly happened there, but sometimes overseas, different doctors, they have differing opinions.
Okay.
So like I said, probably the doctor was taking on a more preventive approach.
So not the correct doctor for...
Yeah,
okay.
That could be one of the reasons as well.
So Shantal, I'm actually wondering, why is this service so important? Whether it's in the local context or is it in the overseas context?
I think It is important because as a healthcare navigator, right, we are very familiar with our doctors in Singapore. We know which specialists are good in which specialty, the suspects as well. So for local client, right, a lot of times is all about navigating the right panel, that's one. And also we want them to visit the correct doctor based on their sign and symptom. So sometimes when when the patient is panicking or in anxiety, they may not know where to go exactly. Right. Yeah, so that's where we come in and calm them down and let them know that, okay, you are able to see this doctor who is available to see your condition and where can you go to. Yeah, and with that, in fact, within a day, we are able to sort out their queries and they then can just rest assured and go ahead with their appointment without worrying whether is it covered by insurance. Because as you all know, healthcare in Singapore is pretty costly, especially in the private sector. So a lot of times, clients, they depend on their insurance, both their personal hospitalization plan as well as their personal corporate plans.
Yeah, so this is the point of view of a patient.
Yeah.
Right. And you mentioned that actually you have a lot of different partners previously just now as well. We work with different partners. And you also mentioned that one of the partners they work with are insurance agent.
Yes.
So how does this help overall as well? So
how do we help insurance agent is whenever they sell a certain health plans to their client, right? Sometimes their client will call them and, like, hello, I have this symptom. I wanted to know if the policy I bought from you, is it covered? Since now I'm having this condition. Yeah, so then these are things that we are able to guide them along based on their sign and symptom and check with our doctor whether this condition requires them to see a specialist immediately or not. If they are not required to see a specialist immediately, sometimes we may even direct them to our GP partners as well. So then these kind of give them the direction on where to go exactly and what's covered and what's not covered.
Right. And another partner that you also mentioned was doctors.
Yes, that's correct.
How is this an important part? Do you own doctors?
So we don't own doctors. In fact, what we do marketing for our doctors.
Okay.
So we market our doctors to our clients, to our corporate clients, to our overseas partners as well. What we do is we will showcase our doctors on our website and let people know that these are the doctors that we work with. And we have all the different specialists under our panel. So our relationship with the doctors is we are partners. We are not, we don't own their clinics, but we do marketing for them. So we direct the patient to this group of doctors that are under our panel.
Right. And you also mentioned hospital, is that right?
Yes, that's correct.
Yeah. So how does hospital come in? Because okay, I can understand the point of view of a patient because I want to make sure that I go straight to the hospital and I see a correct doctor. But to the hospital, it's just a matter of I give you a bed and all, isn't it?
Yeah, that's correct. So what you pointed out was correct, the bed, the wards. So availability of the ward, as you know, Singapore is, land scarce. So to be honest, a lot of the beds these days are fully booked out. So what we will do for our client is we will check with the hospital, are there beds available? So that we then direct the client to the correct hospital if it's an emergency. Then from there, they do not need to wait a long time or they don't have to face the disappointment of arriving in a hospital and realizing that there's no bed, there's no ward available. So then they wait a wasted trip and then end up being directed to another hospital.
Wow, so you're like a full-fledged, matchmaker, One case, you have like 4 things to match. So to make sure that all the stars aligns.
Yeah, that's right.
So if the client or in this case the patient, right? Can you recap again? How do they come to you? You do the basic triaging, or you do triaging with a GP?
So we normally
because
don't
what I'm thinking of is that the patient would likely need to see a doctor first. Why would they call the agent, or how do they reach you? Yeah.
Yeah, so why they call the agent first is because they want to know whether this whole hospitalization or even the consult itself, is it covered with a specialist?
Okay.
So when they go through them already, right, we'll usually get them to reach out to us so that we can guide them on where to go. We do not give any medical advice as we are not medically trained. But what we offer is based on their sign and symptom, we can minimally help to identify which specialist should they go to. Example, if they have a shoulder ache, shoulder pain, shoulder sprain, then immediately, we know it's ortho. If they have a upper abdominal pain, then we will refer them to a gastro. So these are some of the symptoms that they will tell us, and then we'll guide them. Or if they are stroke, we'll refer them to a neurologist.
Well, but in this case, should the insurance companies love or hate you?
As a matter of fact, I think the insurance companies love us. As you know, insurers, what their main goal as a business, by selling a health protection plan is always about keeping their claims as low as possible, because that's how they make money from such plans. But on our end, we are kind of guiding the client on how to utilize their plan based on whatever coverage that they may have. But I would like to see it as something that we can help them with, because what we actually do is when a client comes through us, right, we will try to identify a few things. First, of course, their symptom. What exactly their needs are. Do they want to see a doctor immediately, or can they wait out? Then we can do it as an elective case where we book an outpatient appointment for them. And we'll try to find out what policies are they holding? Do they have a corporate insurance? Do they have their personal hospitalization plans? So from there, assuming if there is a need to do a major surgery, right, we will try to do this thing called the multi-claim process, where we get them to claim from their various policies, including their MediSave as well, if they are a local client. So in a sense, for example, a certain percentage of their bill can be claimed under their hospitalization plan, another percentage using their corporate plan, and then lastly also MediSave. So in this case, we kind of cost contain across all their insurance for them. But of course, if they come to me and they tell me they do not have any insurance, then we can't do that. Then that will be out of pocket. And that's where we also come in to do a little bit of financial counseling, letting them know what exactly is the total amount of the bill going to be. And all our doctors, they follow the MOH fee benchmark. So we are not worried about them overcharging the client.
So you were saying that there is a benchmark table for what the doctors should charge for a particular procedure.
That's correct. So if you go Google, under the MOH website, all the surgery is out there. The table codes, the kind of surgery, the type of surgery, the price range are all there.
And the doctors must follow, or they are strongly encouraged to?
So there is no hard and fast rules that they must follow, but definitely they are encouraged to follow. So what we can assure is that under our panel, they all follow the fee benchmark.
Okay.
So one of the case that I could remember very clearly even till date, right, was during my first year of running the business. There was a patient that came to me in the 20s, with a symptom of frequent burping. So to us, this is pretty normal, because sometimes, after a fizzy drink or after a full meal, you tend to burp a little bit more. So when I arranged for the client to see a specialist, and after going through the scans and some blood work, he was actually diagnosed with stage 4 colon cancer.
Oh, wow.
Yeah.
So
So
what
that
kind
was
of
really
brought him or her to you?
So what
Was it a
actually-
long burp, or is it short burps?
Yeah, so it's really frequent burping. So he was burping very often.
And what's often?
Probably, if I don't remember wrongly, it was maybe 4 or 5 times after a meal, and every 2-3 hours he will burp as well.
And was it uncomfortable? Because I'm just thinking, most people, burp lah, then why would they go and see a doctor for it?
Yeah, I think because he realized it's too frequent, and the kind of burp that he does is really he told me it was annoying him already. It was to the extent that it was annoying him. So then he came to us, and then we directed him to a general surgeon, and that's where he was diagnosed.
And what are some of these tests that he did in order to...
So on top of the frequent burping, right, he was actually experiencing a lot of abdominal pain and discomfort.
Okay.
Yeah, so then led to our doctor actually arranging for him to do a
CT
endoscopy.
Endoscopy, okay. And he found was stage 4
Yes,
colon cancer.
stage 4.
Stage 4.
Yes, that's right.
How
So he
old
did
was he?
both endoscopy and colonoscopy.
How old?
He was in his 20s.
20s.
Yes, that's right. Yeah.
So what happened after that? Did they have to cut the colon?
Yeah, so after that, he had to go through treatment. Yeah. And lucky for him, he survived.
Oh,
so
that's
we
good.
were
That's good
really
news.
happy. I think because we were also a little bit worried So till to date, he survived there. So it's good that I think he came to us because immediately we could arrange for him to see a specialist and immediately, get it diagnosed and start the treatment. Yeah.
Do you think a GP would have caught something like this? Or what do you think a GP looks out for?
I think in most times the GP would probably give simple meds first and probably do some blood tests if required and ask the patient to monitor.
And monitor lah.
Yeah.
Okay.
Most times
That's the normal SOP in a way.
Yes, that's right. That's the usual SOP.
Oh.
Yeah.
Okay. And is there another, what else?
I think probably something that kind of shocked me was we had an overseas case and just so happened client know a specialist here in Singapore as well. So when they contacted the specialist, they actually, the specialist was very kind to arrange for his doctor friend to see the client. But he then conveniently slot in his doctor fees into the total bill as well because this was actually a stroke case. So the right specialist should be a neurologist. Yeah, but that didn't happen, that specialist became the primary doctor and gathered all the other doctors in.
But is this a normal thing for, let's say, I don't know, an orthopedic, right? To be a coordinating doctor?
No, I don't think it's normal because most time when they arrive and they let us know what are their symptoms, or some of them they would already have some reports on hand. What we'll usually do is just follow the specialist that they've been seeing in the country and call on the specialist that's supposed to see them. So I think proper matching is very important.
And when you meant slotted in doctor fees, is because the doctor fees were exorbitant, or were they like consult fees? Surgeon fees or consult fees?
Yeah, so it was surgeon fees.
Okay.
Under the
Then
hospitalization.
Can.
Anything is possible actually, but do you think...
Never cut what? Then how do surgeon fee?
I mean, he's the doctor, he charged. Clients overseas, he's rich. There you go.
So sometimes we try to prevent these things from happening. Because what we want is to keep the bill as reasonable as possible to the client and ensure that they see the right doctor immediately, especially for clients that are coming from overseas. We don't want to waste their time or incur extra stay in the hospital.
Okay. Because it's a hospital, it's not a hotel, right?
Nowadays it's a different thing altogether. So Shantal, how do you even land up into this career?
Okay, I think that's an interesting question. How I actually land up in this career was I was previously working for another medical provider. Yeah, so they were providing similar services, but only to local clients in Singapore. Yeah, and I saw the gap in overseas clients coming into Singapore. So then that's where I kind of want to do it for people who are overseas traveling into Singapore, because Singapore is, after all, a health hub amongst the ASEAN countries, especially our neighboring countries. And also I went on to take on a role in a GP practice. So as a BD there, that kind of gave me more exposure. And I could even understand clearly where the gap was amongst the local in Singapore. Yeah, so I quote an example in a GP setting. Whenever a client see a GP, right, and if they frequently see the GP for the same reason, there may be some time where the GP would then write a referral letter for them to see a specialist. Yeah, so then that's where there should be someone navigating for them where to go. But of course, as we know, some of our GPs, they will write to their good friends who are within the same specialty. But sometimes in a local context, especially when it comes to insurance, they may not match them to the right panel specialist that is under their insurance. So that's where we come in and fill in the gap.
Yeah.
When you mentioned always see the doctor for the same reasons, what are some of these conditions?
I think some of the conditions that has been very common these days are eczema clients, patient with skin conditions, rashes, scratching till they are bleeding.
Ouch.
So these are some of the very common ones. Another one is always also relating to, abdominal discomfort, frequent constipation, blood in stools. Yeah, so these are also pretty common. And also the few top one are also sinus. There are many people with sinus related issues where it's unsolved even after doctor administering them with nasal sprays. They still get recurrent sinuses. So then that's where we will refer them out.
So the correct tract, what's the correct tract by right?
I don't think there's any correct track, like in terms of whether should they go to a GP first or should they go directly to a specialist. But most times, I think clients, they would go to wherever is convenient for them. For example, if I'm living in a neighborhood area in the heartlands, I will visit
See a family doctor.
a family doctor first. Yeah, but if let's say I'm probably working near Orchard, near where the specialist clinic are, then I will probably just try to book an appointment to see a specialist directly.
So if let's say continuous recurring sinus problems, see a GP, then the GP by right should send it to a ENT, for example. Is there any deviation from this? But that means looks like it's supposed to go to the ENT, but actually it's something else that's underlying.
So far, we
So by the way,
haven't-
ENT, what's ENT stands for?
Ear, nose, throat.
Okay.
Yeah. So far, we do have some cases where there is other underlying condition, like for example, sleep apnea, which is causing some breathing difficulties.
Okay.
Yeah. So then that specialty is also ENT. But then again, who is the correct ENT to go to? Because ear, nose, throat, right, is very broad. So usually for such cases, right, we will try to refer them to a specialist that is specialized in sinus, sleep apnea, sleep disorder.
Okay.
Yeah, so that's where we will find a subspecialty in that field for them.
Okay. What's a subspecialty for a doctor?
So a subspecialty for a specialist is where, I give you an example. If you're orthopedic, there are so many body parts on you. So some of the specialists, right, they may suspect in a certain body region.
Like
For
hands?
example, yes, hands.
Okay.
So there's hand surgeon. Then there's also specialty where suspect on shoulder or suspect on foot and ankle, hips and knee. So these are the ones where we will identify. And ENT also, suspect ear, hearing issues, hearing loss, suspect nose, sinus related. Yeah, suspect throat, thyroid related. Yeah, so these are
then
some
lungs,
of the suspects. Lungs will be lung physician. So that will be another
Specialty of its own.
on its own. Yeah, that's right.
Ooh, I never knew. I thought lungs is connected to ENT.
I never knew any of those that you just mentioned anyway.
The stomach and the intestines are all different.
The stomach and intestines, usually in this case, right, there can be some confusion whether to see a general surgeon
Okay.
or to see a gastro.
Okay.
Yeah, so most times when it's a internal organ like liver, I would refer them to a gastro that is suspect in liver. Yeah, or digestive. Yeah, then if it's a very general, like they just tell me, just food poisoning, then I'll refer them to a general surgeon. But for ladies, if they tell me it's a lower abdominal pain, sometimes we will probe them further if they, they've seen a gynae recently, have they done their ultrasound, to just figure out, should we refer them to a gynecologist or gastro?
Okay. Because that's a little bit more confusing, right? Because there are more organs packed in a lady.
Yeah.
Wow, actually those are very interesting. I didn't even know that. So from there, you opened the medical navigator.
That's right. Yeah.
Wow.
So over the years, right, we have collected 7 years worth of data of, which symptom and which specialist should they go to, and the outcome of the surgery done by our surgeons as well.
Okay. Whether it's successful.
That's correct. Whether any complication, because as you know, there are many complex cases that could occur as well. So we also want to know who are actually very good at such complex cases. Yeah.
So
What's a complex case?
I want to ask that too.
Yeah.
Okay, so sometimes it's always about tumor surrounding their organs.
And many organs, touches many organs.
Yes, that's right. Or it could be, I quote an example like pancreatic cancer. There's a cancer that is very difficult to detect. And sometimes even when detected, right, they may not get the right spot to collect the biopsy to test for cancer as well. So we do have cases like that where, there has been delayed in diagnosis for this client. And that's where we learned that we should always identify the right specialist for our client based on really their sign and symptom. Yeah. And another example, so we have a client that did scope, colonoscopy, endoscopy, found out that, got a large tumor, almost 20 over cm around the colon. But then again, doctor thought it was cancerous and told the client that, this is cancerous. So, the poor client have to live in fear that whole entire week, fearing that it's cancer and asking what's the next step.
Yeah.
So that's where we came in and actually do another scope for the client. And in the end, the client was actually diagnosed with TB. Rare TB. Yeah, that's right. So sometimes I think the misdiagnosis could be quite traumatic for clients also. Yeah.
So as a patient, as someone, coming in, gotten a certain reports and all, right? On which circumstances should I go to a normal GP? And which circumstances should I actually look for someone like you?
I think most importantly is most of the patient, right? They actually know their body best. Yeah. So most of the time, whether should they go to a GP first or should they go to a specialist is how they feel at that point of time. If they're really feeling very uncomfortable and they feel like it could be life-threatening, right? Then they should call 995. But if they think that they could wait out, right? Yes, they can reach out to us and then we will probably direct them to the nearest doctor to where they live first. And if, let's say, a GP says that they need to see a specialist, then they can come to us and we will identify a specialist for them.
Yeah. What are some myths in your industry that, people think that it is or isn't, but actually it's the other way around?
I guess one of the myths in our industry is that they always think that we coming through us, right, the doctor bill size will be higher. Yeah, because doctor has to pay us for our service. Yeah, but actually that's not the case. In fact, a lot of our clients, when they come through us, right, like I said, our specialists will follow the MOH fee benchmark.
Yeah.
And they do not actually mark up the prices also.
And how do the doctors work with you?
So most times how the doctors work with us, right, we are like their marketing arm. So all doctors, they will have set aside a marketing budget and we are then included in their marketing budget.
So what's an ideal doctor partner to you?
So how we actually profile our specialists, right, is really based on response time. That's one. Because I think it's very important for the doctor to respond quickly to us, be it the team that's working for the doctor. Because when it comes to healthcare, right, most times people tend to be a little bit, anxious.
It's important after it's personal.
That's right. So we would also want to give them a fast response whenever they reach out to us. Yeah. And also sometimes when it comes to emergency cases, we also hope that the doctors are able to support us. So we will try to pick doctors who are fast response and of course, good doctors. So doctors who are in the field for, at least 20 years. Yeah, we want them to be senior in their field. So these actually add on to additional kind of experience to the client, give them assurance that the doctor that they see are good and experienced also. Yeah.
How about a hospital partner? What's good?
As for hospital partner, I guess it's always about the availability and the readiness on keeping their wards available for us. So some of the partners that we have, they do prioritize our patient. So whenever we request for ward availability, they would actually kind of set aside some wards for us. And in terms of timing also, I think some of the hospitals do tell us, at what time they would have bed clearance because probably patient from the night before are getting discharged. So these are the kind of information that we do get from the hospital. So I think communication with the staff on the ground is key. And also, one of the hospitals that we work with, right, do give us a lot of support in terms of service-based, value-added services for our client, where they provide, a limousine ride back upon their
wow.
discharge. Yeah, so these are the kind of service that we hope we can get from more hospitals as well. But nonetheless...
But is a limousine charge to the patient?
Yeah, so for now it's complimentary.
Complimentary, nice.
That's nice.
So that's a good perk for our patient. Yeah.
And why is there a limousine? Why do you think that that's a good perk to have?
I think because when you're discharged, right, imagine if you need to take a MRT or a bus back. That's also not a very comfortable experience.
Okay.
Yeah, so with a comfortable ride back, I think it's always a plus point for the patient.
Every part of the journey counts, right? From the start all the way to the end.
That's right.
And all, even the follow-ups and all. Yeah. Well, Shantal, now let's head on to our Enzo segment.
Enzo, let's go.
This is the Enzo segment. Over the course of interviewing and networking, we realized that many people do not know what question to ask. Hence, we came up with this. It's as simple as pick up a card and ask that question. So Shantal, this is the Enzo segment, right? So over here, what's going to happen is you will choose 2 cards, right? And each card comes with a question, and we will pass it to us and we'll ask you that question separately.
Okay. Cool.
Simple?
Yeah.
Alright,
simple.
so come, let's choose the card.
You choose a card.
Okay.
Anyone?
Just one middle.
Alright. Alright, your first question. Okay. Can you describe the moment or event that made you decide to take the leap into your career?
I guess the moment that made me decide to take the leap to my current career is really the gap that I saw that existed in Singapore itself. Really someone there to navigate a patient on where to go, which specialist should they see. And also even for the overseas clients, where exactly should they go to when they come in, and can all this be prepared for them prior to their flight into Singapore? Yeah, so that's where I realized I can fill this gap. So then I decided to, set up a healthcare navigator company.
Right.
Yeah.
I think the general journey is that usually the patient will not know what to do, correct?
Yeah.
Yeah.
That's right.
And anxious really.
Yeah.
Yes.
And the doctors themselves, they are not, they are doing their job, right, in their own field.
Right.
But the patient is not exactly going through an easy journey.
Yeah.
Yeah.
That's right.
Right.
Okay.
Right. The second card.
Okay, this.
Come. Second one. How did you prepare yourself for the challenges that you have anticipated in your career?
Wow, that's a tough one. In fact, I've never really prepared myself because, to be honest, even till today, after 7 years, I still see a different scenario every day. Because, when it comes to healthcare, I guess that's the interesting part. You never know what symptom you will see because every human is they're different, right? Everyone has their own pain points. Yeah. Everyone have their own health condition, medical history, even like genetic makeup. Yeah, so even till date, right, I am still learning. Yeah, but when it comes to any medical questions, right, I'm thankful that I have my pool of specialists to lean on. So whenever we are unclear, unsure, we will actually check with them. And that's where they'll tell us, whether, for this case, who should they see? What should they do? Yeah, so I guess that's one of the way we overcome this challenge as a healthcare navigator. And I think, of course, there will be that other business questions, right? When you ask yourself when you start a company, will this be profitable? Will I be able to sustain the business? Yeah, so I guess I had that planned out for at least, I had a 2-year roadmap that I planned out. So I'm really glad that so far everything has been going smoothly. Of course, there will be challenges, but whenever there's challenges, right, in fact, I'm glad that I have mentors in my life as well to guide me through. And so far, it's been working out well as well.
So actually, what keep you going? Is there days that you wake up and say, I'm very tired, I don't want to do this?
I guess what keeps me going
You're the
is,
only partner, right? You don't have any other partners, right?
That's right.
So what keeps you going?
I think what keeps me going is really about, once I do a successful case, or even in fact every day, we see many cases. Yeah, I guess it's the outcome where we see the client satisfaction with our service, and also the outcome of their surgery. They are well. And even in cases where we manage to diagnose exactly something that other doctors in their overseas country couldn't diagnose. So then that gives us that motivation to continue doing what we do, where we serve the client based on the needs that they have. And I think this is key because most times, right, a lot of clients, when they come to us, sometimes it's already like third opinion even, especially the overseas clients. So it means that they are really clueless. They've seen multiple doctors and nothing was done. The condition that they are seeing is still recurring. Yeah, so then that's where we manage to solve it. So I guess that's what keep me going. It's about providing the right care for the client.
Thank you very much for that. So Shantal, what's the biggest life lessons that you have to share with us from your experience?
I guess one of the biggest life lessons that I've kind of learned throughout my journey in this space is really about preventive healthcare. Get yourself screened early. Yeah. So there is certain kind of screenings that you're supposed to be doing, at below 30 or within the age of 30, 35 or even 35 and above, and then 40 and above, 50 and above, 60 and above. Yeah, because a lot of times when the patient come to us, right, they are really in a sort of critical stage. Yeah, and that's where we came to realization that this group of clients that we have, right, they do not do screenings. Yeah, so in my opinion, if we can actually detect our illnesses earlier, then that's where you can also potentially save money on further treatment. Yeah, because once the case is very critical, that's where more healthcare cost will be incurred. Whereas when we talk about health screening with all our government subsidies these days as a local, I mean, you can get a screening done as low as $100.
Actually, do you think why they don't do screenings and all? Was there a reason?
A lot of times, right, a lot of my clients will tell me, say, I don't want to find out because once I find out, I may need to incur more costs. Right? Yeah, that's right. So, but actually, I think it's not true. In fact, when you find out, you know how to actually manage it could be, maybe mild diabetic, that's where you can manage your diet, have lesser sugar intake, example. Yeah.
But if you explode into full-fledged diabetes, then you can't even enjoy some sugar.
Exactly.
Saying that even if you don't screen, you don't find out, you will still kena out, right? In fact, I did a quick search here about health screening numbers in Singapore. Only for 49% of residents get annual checkup. In your opinion, do you think it's increasing? Is it a getting better trend or getting worse?
I guess the trend is getting better with our Ministry of Health promotions and especially with Healthier SG. So I think that's where a lot of them are getting screened for chronic related illnesses. Yeah, which is a great thing. So that number should be increasing. But I think more importantly beyond that, people are also now looking into things like longevity. Yeah, so then that's where there's additional screenings to be done. Yeah.
Is that a subject that is growing in popularity in your opinion?
Definitely.
So what's longevity?
In fact,
Maybe to explain.
I think, again, longevity, there's many definitions to it. To some people, they may think it's like biohacking, try to reverse aging. Yeah, but for us, I guess I see it in a more scientific way where maybe you can screen nutrition level in your body, how is your magnesium, zinc, calcium. Because I think these are things that are important. And when you keep this nutrition in place, right, that's where you can actually live healthier and live longer. And at the end of the day, you don't want to live longer and be unhealthy.
One more for AIA. Live better.
Live better.
That's the slogan, right?
Yeah. And those can only be detected through blood work or?
Yes, that's right. So most times it's
You need
always
a
done by blood test.
Okay, it's not like measurable wearables.
So wearables is more on after you get the blood test done, then that's where you start monitoring your health by wearing those wearables in terms of tracking your fitness,
Okay.
tracking your, I guess your pulse rate, your metabolism.
I see people do the diabetic patches.
Yes.
And that's like a small little prick, right? That measures the...
Yeah. So because there's some correlation between your diabetic health and your metabolism. So some of them wear it for wellness purposes. Some of them wear it because they are diabetic. So they want to keep their sugar level in control all the time, even after meals. They want to make sure there's no sugar spike.
That's interesting.
But you will always have sugar spike, right? Depending on what you eat lah.
Yes, that's right.
Okay.
So how young should a person start screening?
I guess I don't really know exactly how young you should start screening, but one identifier is always about you know your body best. So if you feel any slight discomfort or slight changes in your body, then I guess that's where it's time to get screened.
Okay. And based on your experience in business and life, I mean, you've been a business founder for so long, close to a decade, right? What are some of the finance lessons that you'd like to share?
I guess one of the finance lessons I have to share is always keep your costings low as a business owner, especially in Singapore. Yeah, because as you know, everything is on a rise in our country. So when you keep your costs low, right, but yet efficient with the help of so many AI tools these days, that's where I think you will be able to grow your business pretty well because there won't be a lot of costings that you need to worry about every month. And at the end of the day, whatever service that you provide, right, you should place a value to it.
Right. Yeah. So what does the future hold for you and your company?
I guess the future for our company is we are hoping to expand to the overseas market. Probably have a HQ there as well, especially in our neighboring countries, because we do see a rise in both outbound and inbound patients. So, for example, Singaporeans flying out seeking for treatments that are not available in Singapore, such as stem cells, such as alternative surgery that is still on trial in Singapore.
What's alternative surgery?
So one example is a liver surgery that's still on trial in Singapore. It's called hypstotripsy. Yeah, so that's already commercially approved in Hong Kong.
Oh,
wow.
And what does it do? Yeah.
I don't know exactly into the scientific detail of but what it does is really for patients with liver issues.
Okay.
Yeah.
Right.
Okay. And stem cells, what do they...
So stem cells, there's been a lot of controversy about it as well. But what it really helped in is in terms of recovery for things like maybe some of my clients, they actually see an orthopedic in Singapore and they need to do a knee replacement. But they belong to an age group where they are pretty young.
Too young to do the replacement.
Yes, that's right. Because as you know, replacement probably can only last for 10 years.
Yes.
So if you're like in your 50s, and then
you do
60s. Two times. Yeah.
You might need to do it 2 times, right?
Yeah,
and
okay.
it's not really advisable to do 2 times. So what we will advise them to consider is, of course, stem cells treatment on the knee. Yeah, and some of the clients has actually seen very promising results on this.
Okay.
Yeah.
And I mean, amongst all of this, is there anything that you'd like to talk about that we haven't covered already in this conversation? Maybe something that you are passionate about.
Something I'm passionate about.
Yeah.
I guess like for me, I'm passionate about like women's health. Yeah, so this is something that I'm always looking out for, and I'm trying to find a space where, in fact, I can actually set up a center for women, because there isn't a space like that in Singapore. Like when you think about women's condition, I mean, as a woman, we already have a little bit of disadvantage because of our additional organs. Yeah, so things like breast cancer related, cervical cancer. So these are things that I feel that everyone should get screened earlier and also get their vaccination done. Yeah, and I guess if there is a center like that, probably more women can go there and get checked without feeling embarrassed as well. Because sometimes I think there's still a lot of stigma against certain women conditions. So that's where I'm trying to get rid of it, and hopefully, there can be a center like that someday.
But the government already has one. KKH, is it considered?
I guess KKH is more on a women and children center.
Okay.
Yeah, definitely, yes, they do support a lot of women.
But private sector don't have lah.
Yeah, I don't see any springing up yet in the private sector. Yeah.
Should call it the Shantal Center.
Why not, man? It's a Shantal's Women's Center.
Wow.
Yeah, wow.
No, don't have to be named after me.
So Shantal, for every single guest that sits at that chair over there, right, we will actually ask them this question, right? If there's one word you have to inspire any entrepreneurs out there or anyone looking to succeed, what would that one word be and why?
I think for me, that one word would be empathy.
Empathy. Okay.
Yeah, that's right. Because I think every businesses should be built on empathy. The reason being, we should always try to identify our clients' needs first. And from there, if we can have a solution for them, then there's a business to be done and there's a gap to be filled. Yeah.
Right. So before we end out this whole conversation, right, we have put your focus into this camera over here, right? Any last parting words, advice to our viewers out there?
Prevention is better than cure.
Wise words.
Right. So actually, thank you very much for actually joining us in this whole conversation sessions today, right? In fact, I think the whole journey we went through gave us quite good insights on the whole patient care, how it changed medical industry that actually not many of us actually know about. Right? I think your services provides quite good value to people out there. Yeah. So I really thank you very much for all your insights and all, right? And hopefully we'll see you again.
Yeah,
Thank you.
thanks.
Thank you very much.
Thanks, Matthew. Thanks, Listen.
Hi guys, thank you for listening. If you like what you have just heard, follow us for more content like this.